Tēnā koutou katoa. Welcome to this week's lecture on digestive system conditions. So Rach has taken you through the system itself and helped you understand the anatomy and physiology. So I'm just going to run through a couple of common conditions. So our goal from the session is to understand aspects of common conditions that associate with the digestive system. So the two we're going to look at, the first one is called gastroesophageal reflux, or also known by the acronym GORD, G-O-R-D. And the second one we're going to have a look at is irritable bowel syndrome, also known as IBS. Okay, so gastroesophageal reflux, essentially known as acid reflux, also known as GORD or GERD, G-E-R-D, inflammation of the lining of your esophagus. Okay, so what happens is that happens when stomach acid leaks up or refluxes from your stomach into the esophagus. Okay, there's a ring of muscle called the lower esophageal sphincter that acts as a valve between the esophagus and your stomach. So if that valve is leaky, it allows acid from your stomach up into the esophagus and obviously inflames and irritates it. So that's essentially, in a nutshell, what it is. Okay, what causes GORD? So it happens when the valve isn't working. So we talked about it briefly there, obviously. So it lets acid reflux into your esophagus. Also known as acid reflux, so people will talk about that. If you have it often, it can lead to inflammation of the lining of the esophagus. So the major issue there is it not happening occasionally, but if it's happening on a regular basis, obviously you can do some serious damage to your esophagus, which isn't designed to handle the acid from your stomach. So this inflammation of the lining of the esophagus is known as esophagitis. Okay, common symptoms. Heartburn is the main symptom. So feeling of a burning feeling that rises up from your upper stomach or lower chest towards your neck. Most of us have probably seen or maybe experienced this before. As mentioned previously, this getting it once or twice doesn't constitute having GORD. But obviously if it's chronic and happens over a period of time, then there can be some long-term damage. So other symptoms that people may notice: pain in the upper abdomen or chest, feeling sick or feeling nauseous, an acid taste in your mouth, indigestion, the technical term for indigestion is dyspepsia, and a burning pain when you swallow hot drink. So oftentimes these symptoms are worse after having a meal. We're also going to talk quickly about symptoms that are caused by the irritation. So these are less common. This is something that you'll notice if it becomes chronic. So persistent cough, particularly at night, can cause wheezing, mouth or throat symptoms such as gum problems, bad breath, and sore throat or hoarseness, and severe chest pain, which may be mistaken for a heart attack. So again, these are chronic symptoms. If this happens repeatedly over a period of time, and these symptoms relate directly to the inflammation of the lining of the esophagus. Okay, so the risk factors, the main ones are being overweight, being pregnant, smoking, and abnormalities. So being overweight, as your body mass increases, body mass index increases, so there's your risk of developing it. It's thought that this is because of the extra mass, the visceral body fat, putting pressure on the internal organs, including your stomach, and then obviously putting more pressure on your stomach increases the pressure on that sphincter, which can then cause that reflux. Pregnancy is another mechanical thing that happens. So as the baby gets bigger, as the womb increases, the womb presses up on the stomach. Normally, though, obviously, when baby's delivered, it tends to go away once everything's settled back into place. Okay, so that pressure physically that's put on the stomach is then relieved once baby's born, and then it's no longer an issue. There's two aspects to smoking. So one is nicotine can cause the muscles of that sphincter to relax to allow reflux. And the second thing is it's thought that causing the frequent coughing that smokers do can cause hiatus hernia, which again puts pressure on that sphincter. And the last but not least there is physical abnormalities. Okay, so as human, we're all individual, as individual on the inside as we are on the outside. So some, genetically, sometimes there can be disposition to these conditions because of the physical makeup of your esophagus, and also, the acid in your stomach, and you can be genetically predisposed to that sphincter not working as well. Okay, there also are some, these foods that can make the symptoms of GORD worse. So those that already have this, you could probably highlight foods, each of you individually, that maybe don't agree with you so well. Sufferers of this condition, certain foods will make it worse. Okay, so spicy foods, acidic fruits and veg, so it's like citrus or tomatoes, mint or chocolate, caffeine, alcohol, garlic and onions, fried or fatty food. Okay, so those are the most common foods. They won't be the only foods, it'll be different person to person, but they're the most common foods that will increase the symptoms or make these symptoms worse for those that already suffer the condition. Treatment. Important to begin treating GORD as soon as possible, because if it's left untreated, the reflux will continue to damage your esophagus and create other complications down the track. Okay, so there's 3 different types of medication that are used, and what's used depends on how severe your symptoms are. So the first one I'll talk about are antacids. So those are medications you can get over the counter, no need for a prescription. They neutralise stomach acid and provide rapid relief of symptoms, and are normally only used if the symptoms or the condition is mild. Okay, they don't help to heal the esophagus at all or prevent heartburn from happening again. So short-term rapid relief, so not really appropriate for those suffering the condition chronically. The second type of medication are H2 receptor blockers, so they reduce the production of stomach acid and give relief in many people. So again, used for less severe cases. Slower acting than antacids but provide longer term relief. For many people, this treatment allows your esophagus to heal and relieves the symptoms. So obviously, if you're reducing the production of stomach acid, then it's less likely that you're going to get that reflux causing the inflammation. And the last one, proton pump inhibitors or PPIs, block stomach acid production. They heal your esophagus, and they're recommended for severe cases or severe symptoms. So after your esophagus have a chance to heal and your symptoms improve, normally the strength of the medication will be reduced. Some people will be able to come off it completely, or they may end up with a lowest effective dose to continually manage that condition. So, medication is one aspect of treatment, but lifestyle factors are also important. So those things you can impact in terms of looking after oneself. So lifestyle changes that can help reduce heartburn and reflux. If you're overweight, try losing weight. Easy said than done, obviously, a lot of the time. Excess weight puts pressure on your stomach, causing acid back up into your esophagus. Okay, watch what you eat and how much you eat. So avoid foods that trigger heartburn, and try not to overfill your stomach, because again, that's going to increase the likelihood of that reflux. If you smoke, quit. Again, not an easy one to do, easy to say, not as easy to do, because of the effects it has on the valve itself. Cut back on how much alcohol and caffeine you drink, so both of those things can impact that reflux. Here's an interesting one, so stay upright after a meal. So using gravity to help keep stomach acid down. Wait at least 3 hours after eating before lying down or going to bed. So again, this is one that there's only so much you can do in terms of the sphincter itself. So if we know that you've got an issue there, or you're more predisposed to that, using gravity there to help, the acid production is going to happen anyway. It's going to be stimulated by eating. So if you can wait until that aspect of the digestion has kind of subsided or kind of come down the other side there, then obviously it's going to decrease the amount or the risk of that happening. Okay, if symptoms occur often or at night, another strategy you can use is raising the head of your bed by 10 centimetres. So again, keeping your head slightly higher than your stomach and using gravity potentially to relieve some symptoms. Other things that you can do to avoid or to minimise this is sometimes non-steroidal anti-inflammatory drugs can aggravate this as well. So, right, in New Zealand, up to 20% of the population suffers from this intermittently or continually. So remember, intermittently, we've all probably had or experienced heartburn at some point. If it's intermittent and it's not on a regular basis or continual, then it wouldn't be considered, GORD. But that's something that you want to keep an eye on. So it's usually worse in smokers, the overweight, and those with a hiatus hernia. It can even mimic angina or heart pain in terms of the symptoms for the sufferer. People of all ages can be affected by it, including children. Okay, between 30 and 50% of pregnant women experience symptoms, and this is considered a normal part of pregnancy. So, again, it's something that for most women, it will then subside after baby's delivered. And it's more common in women that have obviously had it before as well. So it's not something that every woman experiences, but it is certainly more likely. Okay, the key points to remember about this, so the main takeaways. So it's only diagnosed when you have a heartburn consistently more than twice a week. So having it now and then, like most of us have had, does not constitute this. It's only that repeated exposure of the esophagus to the acid from the stomach that causes a long-term issue. Okay, so the damage gets done by the stomach and the acid from your stomach, obviously, and the repeated presence of that in your esophagus. GORD is more common in smokers, pregnant women, heavy drinkers, and people that are overweight. More commonly seen in people aged 35 to 64 years. Can be seen across the board, but again, if you look at the lifestyle factors, people within those age groups are more likely to have, say, been smoking for many years, to have pregnancy, to be drinking, to be overweight. So any of those things are more common within that age group and would be contributing factors. Untreated GORD can lead to serious complications. So again, that repeated exposure to of the esophagus to stomach acid is not a good thing over a period of time. It can get pretty dire, and a combination of medicine and a lifestyle are used to treat GORD. So it's not just a one size fits all kind of deal. Important to remember that you want to look at that holistically. Okay, so the second condition we're going to talk about today is irritable bowel syndrome, or IBS. So it's a common disorder that affects the large intestine. Signs and symptoms include cramping, abdominal pain, bloating, gas, diarrhea, constipation. It's a chronic condition that needs to be managed long term. So only a small number of people with IBS have severe signs and symptoms. Some people can control their symptoms by managing diet, lifestyle, and stress. More severe symptoms can be treated with medication and counselling. Okay, so have a quick look at this, the video that's in here. It's a really good explanation of how it works. We're going to go through some of the main points. I'll also put the link up on the Moodle page as well. Okay, common symptoms. The most common symptoms of IBS are abdominal pain or discomfort, often reported as cramping, along with changes in bowel habits. So usually the pain will just be associated with at least two of the following three symptoms. So feeling better after having a bowel movement. So obviously the discomfort after having a bowel movement will disappear. Having bowel movements more or less than usual. Having diarrhea or constipation as defined below. So diarrhea, having loose watery stools 3 or more times a day, and feeling urgency to have a bowel movement. Okay, so normally, we have a certain amount of control in terms of when we do that. If you're having issue with not being able to control that, or needing to get to the toilet really urgently in that situation, then that's a sign. Constipation, having fewer than 3 bowel movements a week. Defined, so stools can be hard, dry and small, making them difficult to pass. Some people find it painful and often have to strain to make a bowel movement. Okay, so for diagnosis of IBS, these symptoms must occur at least 3 times a month. So again, it's not I had a curry last night and things are a bit kind of loosey-goosey the next day. This is something that people with IBS are dealing with on a regular basis, so it wouldn't be diagnosed unless it's a chronic condition or a chronic issue for the patient. Other symptoms may include feeling the bowel movement is not completely finished, passing mucus, so clear liquid made by your gut that coats and protects the tissues, urinary incontinence, so it can be linked to not being able to control your bladder, fecal incontinence, not be able to control your bowel, feeling bloated. Okay, so those are the other symptoms or signs that people may see when they have those conditions. So what causes IBS? The exact cause of it is not 100% certain in terms of what the research is telling us, but evidence is emerging that changes in the bacteria in your gut and inflammation of your immune system may play a role in development of this condition. So in particular, factors that contribute to it are sensitivity, so having a sensitive gut, sometimes called visceral sensitivity. Some people are more predisposed to being sensitive to certain types of foods compared to other people. Digestion speed, this is something, so the contents of your gut moving unusually quickly or slowly, sometimes called altered gut motility. So again, the speed at which that moves through the gut or the large intestine impacts your body's ability to then gain the nutrients from there, and impacts on how much water is taken from the food in that process as well. So body takes too much water, end up with constipation. If it's moving too quickly and the body doesn't absorb enough water from there, then obviously you end up with diarrhea. Okay, bacteria. So people talk about balance of good or bad or bacteria in your gut, sometimes called dysbiosis. So obviously the balance of those bacteria and the impact they have on the foods and the nutrients as they come through can impact this condition. Leaky gut. So when people talk about leaky gut, it's not so much leaky, but they talk about inflammation and have small cracks or openings that allow partially digested food, toxins, and bugs to get through that barrier. So obviously there isn't cracks in the sense that there's holes and everything just leaks out, but the function of those, so the gut is an organ that allows nutrients to cross the barrier between the gut and into the bloodstream. Obviously, so that system or that not working is what we're talking about there, and potentially infection. So infections like gastroenteritis can predispose somebody to developing IBS. Okay, so what triggers the symptoms of IBS? Most people that have irritable bowel notice that different foods or certain foods trigger the symptoms. So in particular, most commonly a group of short-chain carbohydrates called FODMAPs. Okay, so that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So those types of foods are either poorly absorbed in your small intestine or are not digestible for the individual. So sometimes because they're poorly absorbed, when they reach the end of your digestive system, that's where most of your gut bacteria live. Your gut bacteria ferment them, producing gas, which leads to bloating and flatulence, and obviously that sometimes that pressure or that feeling of discomfort. FODMAPs also have an osmotic effect. So remember, osmosis is the movement of water across a cell membrane. So they either draw water into your bowel, which can cause cramping and more bloating. Depending on your digestive system, the combination of producing gas and drawing water can lead to inconsistent or excessive bowel movements. So on one side, excessive bowel movements, diarrhea, watery bowel movements and trouble controlling that sometimes, or on the flip side, constipation, not enough water in the stool, and tummy pain. So the process is also more likely to be made worse by stress or lack of physical activity. Okay, so in New Zealand, approximately 1 in 7 New Zealanders are affected by irritable bowel syndrome. Anyone can develop it, although the symptoms usually begin in early adulthood, and it's more common in younger people rather than in older. Women seem to be twice as more likely to get it as men, is what the research is telling us as well. Okay, so a few things about numbers there. How we deal with it, how we treat it. So there's no cure as such, but treatments can make a big difference. So the options include following a low FODMAP diet. So remember those types of foods that aggravate it. You can eat a diet that is low in those, that reduces the irritation of that digestive system. Reducing the stress, so talking about managing stress, obviously so many different ways to do that, but increasing physical activity, so being more active produces and encourages that gut motility. Taking probiotics, so things that promote the good bacteria in your gut. Potentially the use of medications, and in some cases cognitive behavioural therapy can be helpful as well in terms of helping people manage this condition. Okay, the takeaways, the key points for us are that IBS is a chronic gastrointestinal condition, so it's ongoing, again, much like GORD, It's not the same as inflammatory bowel disease or IBD, which commonly refers to long-term serious conditions called Crohn's and ulcerative disease. So just to make the distinction there. Can be uncomfortable, but is usually harmless. Okay, symptoms includes bouts of abdominal or tummy pain or discomfort, bloating, changeable bowel habits from diarrhea or runny poos to constipation. It affects 1 in 7 people and is more common in women than men and in those aged under 50. So changing to a low FODMAP diet improves symptoms in 3 out of 4 people. Keeping active and managing stress can also help. Okay, if dietary and lifestyle changes don't help, there are medicines to help relieve specific symptoms. So as generally is the case with these things, a combination of those approaches to improving a patient's condition is more effective. So not just the lifestyle changes, not just the medication, but a combination of both is going to be most effective. Okay, so relevance to HCAs. As an HCA, you'll need to know the diet of your clients. You'll have some kind of idea based on what's happening within your facility. So there may be certain foods that some of your clients should avoid or can't eat because it'll cause these type of aggravations or symptoms. So you need to help clients manage medication, such as ensuring that they take it and reporting if they do not. So if they have irritable bowel or if they have GORD and they're meant to be on medication for it but they're not taking it, obviously that's part of your responsibility as an HCA to monitor that. Some people may have exercise programs that will help with this. So it may be as simple as making sure that they get on the walking frame and get down to come out to dinner rather than having dinner in their rooms, whether it's something specific that's been set by the physiotherapist. So part of your role there is, you've got a role in encouraging your clients to engage in those and reinforcing the benefits to them of that stuff. Okay, reporting any changes in the client's condition or food intolerances. So anything that you notice, anything that they communicate with you, obviously needs to be reported. If symptoms occur at night, again, the suggestion that, and especially with GORD, and sometimes with IBS as well, raising of the bed by 10 centimetres at the head can help relieve symptoms in some cases. So it's not going to work all the time, but as a strategy that you could use if you know your clients or your patients have an issue with this. Okay, there's references for you. So there's going to be a couple of activities here for you to have a look at. Be sure to go back and have a look at that video on IBS that explains it really well. It's only about 4 minutes. I'll pop the link up on the Moodle page as well as having it in this here. So when you look at the PowerPoint itself, you'll be able to play the video or you can go directly to the YouTube link. So have fun. Don't forget to do the quiz. So the quiz will be open the week after this content goes up. And it should be, for most of you, it should be the last of these quizzes to do. Once all those 10 quizzes are squared away, then that part of your assessment is done for anatomy and physiology. Okay, so I'm going to sign off there. Stay safe. Hopefully the sun's shining wherever you are. If you have any problems at all with this content, please reach out to your tutors or your supervisors. Okay, ka kite anō. We'll see you again soon. Bye-bye.